This is a really very interesting case of a 34-year-old male patient who presented with sudden collapse, GCS of 4, and CT scan was done initially, and the findings are as follows. I will go straight forward to some findings which are very crucial for the diagnosis. The findings are really very subtle, and let's start from these points. The posterior, the dependent part of the occipital horns of the lateral ventricles. I will zoom in to see a little better. Here is the finding. There are some hyperdensities, and these findings represent fresh blood. So this finding is highly suspicious of subarachnoid hemorrhage. It is very difficult to see the sulcal hyperdensities. However, the peripheral subarachnoid space cannot be optimally evaluated in this CT scan. Okay, now let's go to the finding again, because it's very important. Here and here, these small hyperdensities. Another interesting finding is that there is a degree of hyperdensity around the transverse and the sigmoid venous sinuses. Here and here some hyperdensities. And another interesting finding is that at the level of the vertex we can see some dilated and slightly hyperdense vessels here and here mainly. This is unusual finding. There is mild hyperdensity in the superior sagittal venous sinus as well. Now, due to the given subarachnoid hemorrhage, clinicians agreed with the radiologist's recommendation to proceed to CT angiogram of the head to rule out any intracranial aneurysm and to confirm the venous sinus thrombosis with CT venogram of the head. In the CT angiogram of the head, all the arteries were normal. No aneurysm or AVM was found. However, in this non-dedicated CT scan, there was inhomogeneity and some filling defects in the venous sinuses. So, CT venogram of the head was performed to confirm the diagnosis of the venous sinus thrombosis. Here is the CT venogram of the head. Just have a look in the sigmoid venous sinuses, right and left, and the jugular veins, right and left, and you can see that there are multiple filling defects starting from the jugular veins. So all these filling defects represent thrombotic elements, thrombosis. Here again, the findings in another window setting, the filling defects. At this point is the superior sagittal venous sinus, and if we follow it upwards, there is interruption. There are several mildly dilated vessels, veins. There is compensatory dilatation of these veins. Here, here, here. There is a degree of recanalization again. Dear friends, thank you for watching. If you like my videos, please subscribe to my channel and see you the next time.